Horizon and UNBSJ. She's an instructor there. So she has a lot of very important and invaluable information for you today regarding all the nursing types and just kind of what that experience might look like or university experience might look like. So she's going to touch on that with you all.
Thanks, Maria, for the intro. So hi, everyone. My name is Courtney, as Maria said. So I just have a bit of a presentation about my background and to give you all a little bit of an intro to nursing and the specific programs available in New Brunswick. So if you have any questions throughout, feel free to raise your hand. I don't mind if you stop me throughout. Now, I know this this kind of time slot that I have for this presentation is a little bit shorter than my last, so I may try to scoot through some stuff a little quicker, but certainly if I'm going too fast, just put a hand up or let me know. So I'm just going to share my window. All right, can we see that okay?
Yep, you're all good.
Perfect. Okay, so again, welcome. So this is my presentation all about nursing. So here we go. So just a little bit about my background. Just so you all know, I kind of started where you all are sitting. So I graduated from Chipman Forest Avenue School 10 years ago in 2012. From there, I started at UNB Fredericton studying in kinesiology. So I did 1 year in that degree program. And after 1 year, I realized that that really wasn't the best fit for me, but it took a bit of time to figure that out. So from then I went on and studied at UNB still, but transferred into the nursing program. And I studied UNB nursing from 2013 to 2017. So I did want to include a slide just to share a little bit about my nursing experience. So you all know kind of where I've been, what I've been up to. So I did obtain my Bachelor of Nursing in 2017 from UNB Fredericton. I then, in order to practice as a registered nurse in the province, you need to pass the NCLEX registration exam. So I was successful with the exam in 2017 and have been working as a registered nurse ever since. From there, I began working on the transitional care unit in Fredericton at the hospital, which is a unit that has patients that are waiting for placement. So typically patients that are waiting for nursing home or special care home or things like that. From there, I then sought out the family medicine unit at the St. John Regional. So on that unit, you typically care for patients that have some maybe heart issues or pneumonia or diabetes, and even things like dementia. So you're working with primarily the geriatric population. And from there, I went on and worked the general surgery unit at the St. John Regional. So that was a bit of a change, and I actually really enjoyed my experience there. So that was working with post-operative patients that had undergone vascular and bowel surgeries and lung surgeries. So working with a lot of tubes and drains and IVs and lots of really cool stuff. So now I recently this fall took a job with UNB St. John, working in their nursing and health sciences department as an instructor. So I do both in class and clinical teaching in the clinical setting. And this spring I will be starting my master's of nursing with Athabasca University. So to learn a little bit more about teaching at a university level. So just a little intro slide. So what is nursing? So this is a lot of words, a lot of big words, and I'll read through it, but we are going to kind of unpack this and see what all it's talking about. So nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. So nursing includes the promotion of health, prevention of illness as well, and the care of the ill, disabled, and dying people advocacy, promotion of a safe environment, research, participation in shaping healthy public policy, inpatient and health systems management, and education are also key roles of nursing. So what does that mean, right? That's a lot of word vomit. So what are we talking about? So nurses work independently and as a team with numerous healthcare professionals. So you need to be able to work on your own, but also it's really important to know how to work in a team. So a lot of you that are involved in sports and different committees, those things will be really helpful if you see yourself working in a nursing career. Not only do we work with other nurses, but we also work with many other healthcare professionals like physiotherapists, occupational therapists, respiratory therapy, physicians, and many others. So we provide care to patients of all ages with lots of different health conditions. We work in a variety of settings. So not only the hospital, but we also work in clinics and in the community as well, providing care to vulnerable populations. And something that you guys are probably very familiar with right now are the public health nurses that work in the community as well, working to reduce the spread of COVID-19. So that's another one of our roles as well. So that said, we promote health, but we also prevent illness and do a lot of health promotion and intervening before people become ill. So in providing the vaccines, not just COVID-19, but many others. We advocate for our patients and families. So we support patients and families and bring their concerns to light, sometimes when they have difficulty doing so. We promote safe environments, participate in nursing research, so you learn how to do that in the degree program. And we support our practice with evidence. So that means that we learn how to obtain evidence and kind of complete that research, and we provide practice based on that data. We help shape and create healthy public policy, and we also provide education, like what I do for my job. Any questions so far? No? Okay. All right. So hold on a second. Aren't there different types of nurses? What's the difference? So can someone tell me maybe what some different types of nurses are in the province that you've seen?
Somebody in my class said LPN.
Yeah.
Yep.
So we're going to talk about LPNs. Are there any others?
Someone here mentioned a home nurse.
Yes.
Like
yep. Home care. Absolutely. Yep. So there's all kinds of different types. So I'm going to touch on a few. Was there another one?
We had registered nurse, RN.
RN, yeah. So the majority of the information in my presentation will be about registered nursing, but I do have a couple of slides that talk about some different options as well. So yeah, those are all really great answers. So the first one I wanted to touch on was actually, yes, the LPN program. So this is the licensed practical nurse. So to be an LPN, you must be a graduate of an approved school of practical nursing. So LPNs care for patients under the direction and in collaboration with a registered nurse or qualified medical practitioner. So what that means is LPNs always provide care in partnership with another professional. So for example, maybe they do have their own assignment of 3 or 4 patients that they look after in the hospital, but in the event that their patient becomes more ill or kind of takes a turn, they would consult a registered nurse to step in that situation. So to be an LPN, you are required to take the 2-year college program. So those are offered at New Brunswick Community College, so NBCC, and Olton College. And those are just some that I know of here in the province, but I'm sure there are other options as well if you were looking to kind of expand or move out of the province, but we hope to keep you here, of course. So these nurses focus on hands-on practical nursing skills, and they typically provide care to patients that are a little bit more stable with a little bit more predictable health outcomes. So any questions about the LPN role?
No
Like
questions
that?
here.
No. Okay. Sounds good. So yeah, it entirely just depends on what you feel is the best fit for you. And I kind of pointed out to my first group, this nurse in the photo is giving insulin, and LPNs do provide meds. So just in case that was something you were wondering. Oops. So the second one is registered nurse. So this is what I do. So registered nurses are nurses regulated by nurses. So we have our own particular association, the Nurses Association of New Brunswick, that we have created standards of practice that we are all mandated to follow. And we also follow a nursing code of ethics. So providing care that is right and that is best for our patients on an ethical level. Registered nurses deliver direct healthcare services. We coordinate care and support clients in managing their own health at all stages of life. So from birth up until death, and in situations of health, illness, injury, and disability. So in all these situations, we provide care, not just when they're sick, but also when they're well. Registered nurses contribute to the healthcare system through leadership roles in clinical practice, through education, what I'm doing, through administration, research, and policy development. So registered nurses, one of the key differences between registered nurses and licensed practical nurses are that registered nurses are trained to use those critical thinking skills to provide additional advanced nursing care to acute, unpredictable, sick patients. So these are patients that maybe would be more likely to take a bit of a turn. Maybe they are very ill and they require advanced assessment skills and advanced care needs. So our job is to kind of look at these patients from a holistic manner. And by that, I mean, look at all the different aspects of their care. So not only what's going on in the hospital, but maybe what was going on at home that led them to be here. Not only what's going on with them now, but why is that happening? How did that happen? And kind of looking at these things from a wider scope or wider lens. Any questions? No?
No.
Okay. So the third one I wanted to touch on, and there are many, but the nurse practitioner we also see here in the province. So nurse practitioners are registered nurses as well. So you do need to have a registered or a Bachelor of Nursing, but they have additional education and nursing experience. So nurse practitioners are educators and researchers, also clinicians. And they can be consulted by other healthcare team members. So that means if I had a patient that maybe had a complication that didn't require a doctor to assess, but still maybe they needed some medicine ordered or a test, I might consult a nurse practitioner to come and see them. So they can diagnose and treat illnesses, order and interpret tests, prescribe medications, perform medical procedures, etc. So they work in community care, long-term care, so nursing homes. They work in hospitals, outpatient clinics, emergency rooms, etc. So we see nurse practitioners a lot, and I think as time goes on, they'll be more popular in our healthcare system, for sure. All right. Oops. So for the remainder of the presentation, because this is my specific background, I am going to be focusing on university programs. So this would be what you would be required to do to be a registered nurse. So you would need to obtain a Bachelor of Nursing degree. And these are some of the schools in Atlantic Canada or in the Maritimes that offer the Bachelor of Nursing program. So I obtained mine from UNB Fredericton. There is also a St. John location, which is now where I work. There's the University de Moncton, so U to M as well. University of PEI, St. FX in Nova Scotia, Dalhousie University in Halifax, and Memorial University of Newfoundland, or MUN. So there are lots of options. It is important to note that not all universities offer nursing programs. So when you're thinking about where you want to practice, or sorry, go to school for nursing, it would be important to do your research and look to see if they offer that course at that school, and also what the entrance requirements are. And we're going to get into that a little bit as well. Now, I will say before moving forward, if you are interested in the LPN program rather than the registered nursing program, I encourage you to log on to the NBCC website or the Olton College website and have a look at those requirements as well. I won't be touching on them in the presentation, but I definitely encourage you to have a peek. So, University of Moncton is one of the schools available in New Brunswick that many of you may be interested in attending for nursing. So this is a Bachelor of Nursing, and I did just want to list here so you can visualize what the entrance requirements would be to be accepted into their program. So as you can see, they require certain grades in your French, math, biology, chemistry courses, etc. And there's a minimum requirement for entrance as an overall percentage or an average. Now, I will note that every school has different entrance requirements. So depending where you want to study, it is important to look up those entrance requirements. So for example, the University of Moncton has different entrance requirements than UNB. So just keeping those things in mind. Was there anything you wanted to point out there, Maria? Or I know last time.
Yeah, so I know it's on your next slide. So just take note, everyone, that so for those of you that aren't in French, this says, well, you wouldn't be going to U to M if you aren't in French, but it says that the minimum requirement to get in is a 65%, and that you need a minimum of C in French and math and bio and chem. But then, Court, if you want to jump to your next slide.
Yeah.
UNB nursing here, minimum average admission of 75%, and you need a minimum of 70% in your English and bio and chemistry. So it is different, as Courtney mentioned already, for each school that you go to. So you really need to make sure you're looking up not just like if the school offers nursing, but like what the minimum requirements are to even apply.
And what courses are required. I will say as well, and not to deter anybody or to scare anybody, but just because the minimum admission average is 75%, nursing courses or nursing programs are quite competitive. And they do often take those with the highest application average. There are different components to the admission that I think universities are working to implement, maybe an interview or things like that, but I think that's in the works. So there will be other options as well as the entrance percentage. But like Maria said, there are different requirements based on the different schools, but just be mindful that just because you have a 75 does not guarantee you a seat in the program. So again, courses like English, your maths, your biologies, chemistries, they require 2 electives, and it says group 1. So I would have a peek at their website just to see what that means, because there would be courses listed under that category that would be required, and you would choose 2 from that list.
I also just want to point out that you guys might recognize, if you're from Sussex, this man right here. His name is Blair Dow, and he actually went to SRHS when I went here. So now he's a registered travel nurse, so that's what he does. But I thought it was kind of cool that Court happened to put a picture of somebody from Sussex High School here.
Yeah, I know it was unintentional, but I'm glad I did. And actually, one of the professor or the clinical instructor that's in the photo I actually had when I went to UNB Fredericton as well. So you get to know lots of people, and it's neat to see where everybody goes. So just a little bit more about the UNB Bachelor of Nursing program, and I chose to touch on this one the most because this is where I did my schooling. But again, certainly look into, if you have a different preference, you can look that up. The UNB Bachelor of Nursing program is a 4-year full-time program, and most Bachelor of Nursing programs are 4 years, unless there are options to kind of fast track it or to do a accelerated program. The nursing program requires you to take nursing courses, but also English, biology, and psychology courses. So with that said, it's even more important to remember to be taking those courses in high school, not only because they're required, but because you will need that baseline knowledge to be successful in the nursing program. So clinical learnings, which is clinical practice or working right in the hospital with patients, that begins in year 1. So you will start, as you can see in the pictures, you will start working with patients, and not just mannequins, but they're in the skills lab in the photos, but you will work in nursing homes in the hospital directly with patients starting in year 1. So our year 1 students right now are working in nursing homes, learning how to provide basic care to residents in the nursing home. So what's really great is getting that hands-on experience. Students work in the community as well, so you are required to do community clinical to promote health, prevent illness, and share knowledge. So you'll learn how to give immunizations, provide presentations on health promotion, and work with vulnerable populations. And something that's really nice about UNB is each clinical group has typically between 6 and 7 students to 1 instructor. So that allows you to develop really close relationships with your instructors, and there's lots of opportunity to ask questions, and they're available for you in the clinical practice setting. So that's really nice. I have a group that I'll be working with later this week, and there's seven students in my clinical. Is there a question? No? Okay. All right, so just wanted to post this here, and I won't go through it all, but just wanted to show you what a 4-year degree program in nursing looks like at UNB. So these would be the required courses, and it looks like a lot, but if you think about even in high school, the amount of courses that you take over your 4 years, if you were to write that down in a list, that's a lot. So it looks like a lot, but I do want to point out that after year 2, you are required to do a summer session. Now, as Maria pointed out in my previous presentation, summer for university begins at the end of April, and then you start back in the fall in September. So this summer session is only about 6 weeks. So it would be the end of April and usually all of the month of May. And then you would be finished for the summer. So that is just one additional clinical placement they get you to do to meet the requirements of the program. Any questions about the courses? No? Okay. So just wanted to touch a little bit on university level expectations. And if you guys had presentations yesterday, I know Maria, your class did, I'm not sure about the other group, but they would have discussed this as well. So being on time, extremely important, because your instructors and professors are not going to be chasing you for assignments. If you submit something late, marks will be deducted. They are only able to grant extensions and things in specific circumstances, but your learning is your responsibility. They will not be chasing you. If you are maybe unsuccessful, but you choose not to seek help, they're not running after you, asking you, are you doing, how are you doing? Can I help you? No, that it's entirely on you. Your learning is your responsibility. So it's a big change from high school. Not saying that the teachers are chasing you guys in high school either, but a lot of students are a bit shocked when they start university just because of the change. Be prepared. A lot of classes require pre-class readings, and it's important for you to stay on track because it is easy to fall behind because it is a lot of work. When I say full time, I'm not joking. participate in class and ask questions. As instructors, we love to hear from you. The nice part about the nursing classes are that they're quite small compared to many of the classes at universities. So it's a little less daunting to speak up in class. And we love to have discussions. Cheating and plagiarism is not tolerated whatsoever and is a serious offense. Maria or Amy, did either of you have a student that knows maybe what plagiarism means?
You guys know what plagiarism is? Yeah, so they said you steal something from the internet that somebody has already previously written and claiming it as your own.
Yeah. Yeah, excellent answer. And that's exactly it. And it doesn't necessarily have to be the internet, but that is an example. It could be anything, but any work that's not your own. And we can find it, you know. You are required to kind of tell us where you obtained information from. And if we suspect that something's been copied, we find it, and it is a serious offense. So just know that moving forward. And your professors will talk to you all kinds about plagiarism. So just keep that in mind. Very important to be organized in university, as well as maintaining a study schedule and figuring out what works best for you for studying. There also are student services available, I will just say, at each university. So if maybe you struggle with maintaining a set study schedule, or you're not sure what works for you, or maybe you need some organization tips and tricks, they are available for those services. So there is that help available. Okay. Any questions about university expectations? And don't be afraid to ask either. I'm available for questions. All right, so I graduated from nursing school. Woohoo! What do I do now? What am I doing? Right? What am I doing with my life now that I have a nursing degree? So I wanted to talk a little bit about life after graduation. So once you graduate from a nursing school, so with a Bachelor of Nursing, you can work as a graduate nurse. So a GN, until you pass your NCLEX exam. Now that said, you can't work as a GN forever. You do need to write that NCLEX exam in order to be a registered nurse, because that kind of, you have to pass that in order to prove that you have the knowledge to provide registered nursing care. Many new graduate nurses typically work in the hospital, or they provide some type of bedside nursing, because that seems to be where a lot of the jobs are when you first start as a new graduate. But that said, that you don't, that's not always the case. There are many different types of positions that you may hold as a registered nurse if you're working in that environment. So you can work casual. So maybe you choose your own schedule, you pick up shifts as they are offered to you, and that kind of thing. You can work temporary full-time, temporary part-time, or permanent full-time or permanent part-time. So those are all different things. So I would spend some time, if this interests you, getting familiar with what all those things mean. So typically when you're working in the hospital or in a bedside nursing role, it is shift work. So just so you know, many units offer rotations like 2 days, 2 nights, maybe 2 days, 3 evenings, and between each, we call them sets. So day, day, night, night, you might have 4 or 5 days off between. So there are pros and cons to the shift work schedule. One thing that's really nice is it's easy to go maybe on a vacation. You maybe only need to take a couple of vacation days, and then you have kind of this chunk of time off. So there are lots of perks. Your specific workplace offers certain benefits packages. I believe Horizon offers Blue Cross coverage, which is something you will learn more about. And especially now with the shortage of nurses, they're offering sign-on bonuses for nurses. So that might be something that you are offered. So just be mindful and be on the lookout for those. You always will receive an orientation or training to your specific area of practice. I believe mine was 6 weeks when I started at the regional hospital. So you will always receive orientation. From Horizon specifically, I just wanted to share, you do get paid on a bi-weekly basis, so every other week, as per the rates of pay with the New Brunswick Nurses Union. So that is available online for those of you that are interested in finding out what a nursing wage is for registered nursing. So if you look up nbnu.ca, that contract would be there for public viewing. So I'll just move right along because I'm trying to keep an eye on the time. So I'm not going to read all of these off to you. I know this is a very wordy slide, but I just wanted to bring to your attention many of the different areas of nursing that you can work within. And this certainly is not all of them. A lot of these are certain floors or units at the St. John Regional Hospital, but many hospitals have all of these same ones. So just be mindful that you're not limited with a nursing degree. There is so much that you can do. Are there any questions about any of the points here on this slide? Or if anyone wanted me to explain?
Somebody thinks burns and plastics sounds kind of cool.
Yeah.
Talking about that
so
one
I've
for a
worked
quick sec.
Yeah. Oh, was there another question?
Nope, just that one.
Just that one. Yeah, so I actually I haven't worked there a whole lot. There is something that happens sometimes when a certain area is low on staff members. Sometimes we get floated, which means they will pull a nurse from a different area of practice only when they are experienced. They wouldn't do it. They wouldn't do this to somebody that's new. So I did get floated to that floor before, and it is really neat. Unfortunately, I didn't see a whole lot of specific burn patients, but they do have a lot of kind of bandage changes and different IV medications and things like that. And also they actually provide leech therapy sometimes, so which is really cool and kind of gross. And so they have a large bin of leeches that they'll actually put on a patient's maybe finger if they need to replenish the blood supply to that area. They'll do that on that unit. So that's really cool. Yeah, any other questions?
Any other questions? Nope, I don't think so.
No? I may have just grossed everybody out from nursing.
No, that was awesome.
Okay, so some common nursing tasks. Again, I won't read through all of these, but a lot of the things that we do, and this is mainly what we do in a hospital setting, but we do these things in the community as well. Just depends on where you're working. So some kind of cool things that we do. We collect specimens, so all different types of drainage and fluids and blood, and we can complete blood work. We give blood to patients. We can remove staples and stitches. We provide teaching. We also complete basic nursing tasks like helping patients with their personal hygiene and patients that have trouble feeding themselves. We help with that as well. So just because we are registered nurses doesn't mean that we don't do those things. The hospital has moved toward all nurses doing all the care for their specific 3 or 4 patients. So we would do everything for our patients. Okay. Hindsight is 2020. So I just wanted to quickly touch on a few things that I would recommend, or my advice moving forward. So keep your options open. So what I mean by that is don't put all your eggs in one basket. And I would take as many of the university prep prerequisite courses in high school that you can. So all of these, math, science, your physics, your chemistry, your biology, all these courses in grades 11 and 12, because you may change your mind going forward. I did. When I started university, I started out in kinesiology, and when I changed my mind to nursing, I was fortunate that I had taken these courses in high school, because if I didn't, I wouldn't have been able to switch programs. So keeping the doors open, because you never really know what you may want to do down the road. It always changes. So
Will you just touch on your brother there, Court, for a
Oh,
sec?
yes. So my brother has a civil engineering technology. I think it's a certificate, but it's from MBCC. And after he finished that program, he thought it would be nice to bridge over and complete the remainder at university to obtain a degree, because of course you might make a little bit more money. There might be some other job opportunities with a degree program. But because he didn't have grade 12 chemistry, he wasn't able to be accepted to UNB to do the engineering. So he's kind of stuck there. So unless he went back to high school and did grade 12 chem, he's not able to get into the university program. So that's kind of a real life story. So if you can, try to take all these classes, even if it's not nursing that you're interested in. But all right. So I did want to just quickly bring to your attention the value of residence living if you do decide university is for you. So this is on-campus living. There's lots of in-residence activities. You're close to your classes. They provide you with meal plans. And you also, the important thing is you develop lifelong friendships. So I did put a few pictures here of my experience from living in residence. So you are part of many long-standing traditions. That's kind of what we're doing with the pumpkin. And a couple of the friends that I have in these photos, one I will be in her wedding next year, and the other I still am in very, very close contact with. So you really, I can't stress this enough, how valuable of an experience it was. The other thing I wanted to say is, even when you're finished high school and you move on to university or community college, be involved. You know, continue to sign up for things, get out of your comfort zone, do things that you might not normally do. This was one thing that I took part in, this Red Shirts orientation committee. So we helped welcome new students to the university, kind of get them hyped up and happy about coming to UNB. So very important when it comes to team building. Learned about different icebreakers, and these things are all important, and they look really good when you're applying to these jobs where teamwork is so valuable. So just another little tidbit, and this was another activity that I did in university, Global Brigade. So we did a public health brigade in Honduras, which is in Central America, I believe. So we went and helped families install new eco stoves and wash units and concrete floors to help eliminate inequities in their health status. So if you guys had any questions about that, you can send me a message. I'll give Maria my email, and Amy as well. So lastly, I just wanted to say my last bit of advice would be to follow your heart. So I know that sounds a little bit cheesy, a little bit corny, but it's really important to do what's truly best for you and what you want. You know, if maybe your mom or your dad says, oh, you know, I'm a nurse and I loved it and I'd be so proud of you if you did it. Maybe that's not for you, and that's okay. You don't need to do what other people want you to do. Follow your heart and your gut, and you do what's best for you. That said, I started out at the bedside nursing, and then I realized that teaching was for me. When I applied to UNB, I had to give up a lot with my position with Horizon, and I had some people question that. You know, are you sure that's the right thing? You know what? No, but my gut and my heart is telling me that this is what I want to do, so I'm going to go for it. So don't hesitate. Do what's best for you, and it'll be rewarding. So.
Thanks, Court. That's really good advice. That was awesome.
Thanks.
I know you kind of have to skedaddle in like 5 minutes to go to your.
It's okay.
Meeting. Can we just ask you like a couple of questions?
Yeah. Oh my gosh. Yeah.
Okay. Do you guys have any questions, or do you want me to pull from the list? Pull from the list. Okay. And then Ms. Cook, does your guys' class have any questions before I start pulling from the list?
Nothing that they want to ask right now.
Okay.
Okay, so one of the common questions that I did see throughout my classes was, kind of, there's a big nursing shortage right now. We're really pushing for people to join the nursing programs. And we are just kind of wondering if in years when these guys are going off to university, demand for nurses is still going to be there in our province, and kind of what you think about that.
Yeah, so absolutely. I think by then there will still be quite a demand for nurses in our province. We have quite a need right now for nurses, and I can speak to the fact that we have a lot of nurses that are planning to retire here within the next 5 to 10 years. My mom being one of them. Actually, she's retiring this spring, and in her cohort of nurses, they make up a large percentage of the nurses in New Brunswick. So there will be tons of vacancies upcoming. So I encourage you, if this is something that interests you, absolutely. I don't foresee there being any shortage of positions in the future.
Somebody wants to know if you've ever pulled a knife out of somebody.
No. We have found, so there are certain situations when patients become, I'll kind of tell this story. Patients can become unsafe for themselves and to others sometimes when they're confused, and we need to, unfortunately, we have to restrain people sometimes in nursing, and you'll get familiar with that. It's not something we love to do, but we have had patients cut themselves out of restraints with scissors and knives. So very important to something that we do when we admit patients to the hospital. We do have to go through their belongings and see what they've brought in their supplies, because those things pose a risk to other patients in the hospital. So, but yeah, good question.
Caught me off guard. A lot of people asked in their questions too, kind of like, what's the hardest thing about being a nurse, or like, what is the challenges of being a nurse? That was like a really common question.
I think probably one of the hardest parts of being a nurse is kind of the multiple hats you have to wear in the run of a shift, maybe. So you may have somebody in one room that is waiting for a nursing home, and maybe they don't require a whole lot. They're not very sick, but they're lonely, and they would love for you to be spending time with them. And then in another room, you have a patient that's taken a turn for the worse. They're really not doing well. Maybe you're giving them some IV fluids or some blood, and they're taking up all kinds of your time, but you also want to be available for this other patient that maybe isn't so sick. And maybe you have a really good rapport with another patient in another room, but you just had a patient pass away in another room. And not being able to share those things with your patients and explain why you might be unavailable. You might not be as available as you want to be for all your patients. That's hard sometimes. And of course, with confidentiality, we're not able to disclose why we're so busy sometimes.
That's really good. Is there one final question, or Miss Cook, did your class have any questions?
My class is just kind of curious about, like, would you say is the toughest thing or the hardest thing about being the nurse? Like, is it the personal aspect, or is it the technical portion?
That's a good question. I mean, nursing school is difficult. There's a lot that you need to learn from a theoretical standpoint, from a science standpoint. Not only do we learn about the human body and, physiological processes, but we also learn about therapeutic communication, how we talk to patients, and those things. Like I said, how to wear multiple hats in the run of a day, I don't know if I could say one is equally more difficult than the other. I won't lie to you. It is a difficult program. But as you get more education and you get more familiar with the profession, it does kind of become easier as you go.
That's awesome.
It's a
Thank you
lot
so
to
much.
learn.
Yeah, definitely. I know, like, I'll speak for everyone here, but we're super appreciative of you taking your time to come and chat with us.
Oh,
And
no problem.
we'll also see you this afternoon for another presentation, but I know you do have to run to your other
Yeah.
meeting.
Oh, yeah.
So,
It's no big deal.
yeah,
but-
it's 12. So you probably need to skedaddle, but thank you so much for coming and taking the time to
You're
talk
welcome.
to us. And if I have other questions, I'll shoot them your way. And same thing
Yeah.
with Ms. Cook, like we can flood some questions through you if we have some students interested in.
Yeah, certainly. If anybody is curious about nursing or wants some more information or just wants somebody to talk to or ask some questions, I will give Maria my email, and I certainly don't mind chatting with you about it. 'Cause we'd love to have you. All right. Thanks, guys.
Perfect. Thanks, Court. See ya.
Thank you. See ya.